How long does it take to recover from a labrum surgery? This is a question generally asked to me by people that are either about to go through a labrum surgery or they know a family member or friend that's about to go through one, because I have went through 2 labrum surgeries myself. And this really all depends on the severity of your labrum tear, as well as the activities that you plan on doing after your surgery. And also it depends on you and how much effort and how hard you attack your physical therapy and just the recovery process as a whole. So before we get started, the information you're about to hear is from 5 sources. 3 website sources, which is going to be orthoinfo.com or .org, hopkinsmedicine.org, and beaconortho.com, and then as well as Dr. Clay Riley from Martin Orthopedics in Little Rock, Arkansas, who was my surgeon for both my surgeries, and also Josh Bundy from Jones Physical Therapy in Harrison, Arkansas. First, we're going to talk a little bit about the shoulder in general and the types of tear you can have. So the labrum is a muscle that pretty much just circles around your shoulder socket. And the first type of tear we're going to talk about is a slap tear, which is short for superior labrum, anterior, posterior, and it's going to be at the very top of the labrum. Then the next one is going to be the Bankert tear, and it's at the bottom of the labrum. Then you're going to have the anterior tear, which is at the front side of the labrum, and then you're going to have the posterior tear, which is on the back. I suffered a posterior labrum tear as well as a slap tear, and after I had both of my surgeries, Dr. Riley told me that in a study across the whole United States, they found that from the ages of 13 to 20, a labrum tear is the most common injury in any overhead throwing athletes, which would be baseball players, softball players, even some football players, like quarterbacks in general, any overhead throwing athletes. Next, we're going to talk a little bit about physical therapy and the recovery process. So after you have your surgery, you're going to have 6 weeks in a sling. Your sling's going to look like this. And some slings you may have seen, like if you had a broken arm when you were a kid, or if you have a broken arm now, or you know somebody that had one, it's just going to be a sling that kind of dangles, and it's just free moving, you can just do anything with it. Well, when it comes to shoulder surgery, you need to keep your shoulder as stable as possible, and there needs to be no movement. So for sure, the first 4 weeks that you're in your sling, you're going to have to wear your sling, and as you can see, it's going to keep your arm at 90-degree angle. There's going to be no movement. There's a strap that comes around the back, and then it also goes over your neck. You're going to be in your sling for the first 4 weeks. You're going to be in your sling. You're going to have to wear it at all times. Literally anytime you're doing anything, sleeping, eating, going outside, staying inside, watching TV, anything except for showering, you're going to have to wear your sling. But then depending on your doctor, as well as how good you are doing after your surgery, the last 2 weeks you might be able to only wear it in high-risk situations, like when you're out in public, if somebody might bump your arm or something like that. But if you're inside the house just watching TV, just hanging out, nothing's really going on, you might be allowed to take your sling off or something like that for like the last 2 weeks. But like I said, it just kind of depends on how bad the injury is, how well you're recovering from it, as well as your doctor. So next we're going to talk about the physical therapy side. So generally there are 12 weeks of physical therapy that you're going to go through, and normally people are going to go 2 to 3 days a week. So the first 6 weeks of your physical therapy are going to be centered on strengthening and regaining the strength that you had in your shoulder and your arm, because it's been in a sling for 6 weeks, and you've lost a ton, way more strength than you would imagine. So when you're working on the strengthening process, you're going to do a lot of band work, and they have a lot of resistance bands. Most of them look like this, but there's all types of bands that you'll use, and they're all. Some of them, I think this might be 10-pound resistance, but they go up to, I think, 60 and 70 pounds. And depending on your progress and how well you're doing is when you will, I guess you would say, graduate to the next level of resistance to help strengthen your shoulder and your arm. And most physical therapy places have the same equipment. It's like you might use they have exercise bikes that you use for your arms, as well as little weights, and they also do a lot of like for mobility, strengthening, and things like that. But like I said, for the first 6 weeks, you're going to really focus on strengthening your arm back up. Within the second 6 weeks, you're going to really focus on trying to get your range of motion back and get that mobility back in your arm. You'll do a lot of range of motion tests, things like this. And if you're like a baseball player like me, you'll work on your throwing program and just your throwing motion and things like that. And even after you do your 12 weeks of physical therapy, this is like what I talked about earlier. They're going to send you home with a bunch of home stretches and home workouts you can do at your house. And if you choose to do them and do like you're supposed to, then it's going to make your arm feel way better, your shoulder feel way better, and it's going to make your everything go way more smoothly. But if you decide to just kind of not do it or whatever, then you might have a reoccurring tear or even just a constant pain. Now we're going to talk a little bit about how long it's going to take to fully recover and get back and be, medically released, depending on the type of person you are. So, for instance, like me, I'm a baseball player. It was a full 6-month recovery process for me. At 3 months after my surgery, I was allowed to start light lifting weights again. 4 months after my surgery, I was allowed to start swinging a baseball bat again. And then I think on the 5th month after surgery, I was allowed to start my throwing program. And after 6 months, I was fully cleared. For football players, it is anywhere from 4 to 6 months, depending on the severity of the injury, that they will be released back to full pad contact. But most of the time, it's going to be about the 5-month range. But if it's somebody who's not an athlete, if it's just a middle-aged person or somebody that's not planning on getting ready to throw a baseball again or a football or do any type of hard labor or any real physical activity, and it's just a general tear and you're just trying to get back to your everyday activities, it's going to probably take about 3 to 4 months. Finally, I've given all the information I know, but really going through a labrum tear, it sucks. I mean, it's not fun, and it's not something that you can always control. It's not something that you can never prevent from happening. You can try everything, but if it's going to happen, it's going to happen. But for the way I see it, you're really faced with two options. You can either use that as an excuse and complain about it and just complain and be sad and upset about it, or you can just be like, okay, it happened to me. I know what I've got to do. I've got to have surgery. I've got to try to get my arm back to 100% and really try to attack everything and make myself better than what I was before I tore my shoulder and before I had my surgery. So it's all dependent on how you respond. So, how you guys respond is what I would like to know. Thank you.